Y'all didn't hear the announcement. We're now recording. Just heads up. All right, folks, my time is 10:02, so I'm gonna get this show on the road. Good morning, everybody. Welcome to the all members Southside Wellness Coalition meeting. We're glad you're here. The first thing that we have on our agenda today is the approval of our February 15th, 2024 meeting. You all should have received an email from Keenan with a copy of those in there. We have them on the computer.
Yes, they're under your, if you want to click your share screen.
Okay, I'm gonna
Yep,
share the
they're under
screen
share
and pull them up.
screen. You'll see them. Yep.
Okay. All right, so I'll just scroll through them really quickly for everybody. Let me increase the zoom a little bit there. Thank you. All right.
Can't sit down, you know. When you talk to the loud guy, I'll be over here. It's got vanilla, lemon, and orange juice. Should I? Oh, you've never had it? I have, but I think it was terrible. I just made it like 2 days ago. I made it. My mother, I made them. Like that.
All right, so those, that was our February agenda. Does anyone have any thoughts, questions, concerns, comments on that? Okay, cool. Well, then at this time, I will call for a motion to approve, please.
I'll make a motion.
Okay, got a motion. Does anybody second?
I'll in a second.
All
Okay.
right, so motion by Steven, second by Sarah.
Yeah. All
Elena,
right,
Elena.
all good. Thank y'all. I don't have to look at that. The owl looks at me. I have to, y'all bear with me. It's my first time or my second time doing this meeting setup, so I'm not sure where to look.
We got you, we got your back.
I don't know what to do with my hands.
Right.
I love the Ricky Bobby reference. Sorry.
And then also, before we really hop into bringing our guest speaker on today, now that we've approved our minutes from last week, if we could just go around starting with folks in the room and introduce ourselves really quickly. So I'll go ahead and kick it off. My name is Liam Hudson. I am the chair of the Southside Wellness Coalition and the founder and CEO of the Lean In Project. So I'm excited to be here with you all, and I will popcorn it to Christine.
Hi, Christine Pennington, Resilient Pathways, and also the chair of our local trauma-informed care network.
Keenan Tyre Smith, physical agent for the Southside Wellness Coalition.
Sarah Weissman, I'm the marketing coordinator for Southside Behavioral Health.
Stephen Wilson, prior leadership team member of the Southside Wellness Coalition, lived for about 6 years, member of the local recovery community.
Dennis Damians, new to this, representing veterans. We work with both the Legion, the VFWs, and with Vets on a Roll to take disabled vets out on the lake a few times a year. So we're just getting started, looking forward to having y'all participate with us as we work with both disabled veterans and the families with disabled children.
Welcome. We're glad you're here. Thank you for being here and look forward to the partnership as well. All right, folks online, I'm gonna look at y'all now. So I'm gonna popcorn it over to Elena because you're the first bubble on my little screen.
Hi,
You
good?
Yeah, you're good. I just had to let
Okay,
someone-
I'm Elena Martin. I am a housing case manager at Tri-County Community Action Agency. I am also on the leadership for the coalition.
Will you pass it to someone?
Oh, sure. Jennifer?
Hi, I'm Jennifer Lawhorn with the Virginia Department of Veteran Services. My office is in South Hill, and I am new to your meetings.
Welcome, glad to have you. Laura, would you mind going next?
Yeah, hey, I'm Laura Castle. I'm employed with Centera Behavioral Health, and I'm also on the leadership team.
Great, thank you. Brenna.
Good morning, Brenna Link, Population Health Manager for Pennsylvania Danville and Southside Health Districts.
Carolyn.
Good morning, Carolyn Simon with Centera Health Plans. I am on the Medicaid side. My title is Market Development and Community Outreach. So basically community outreach.
Awesome. Glad you're here. Elizabeth.
Elizabeth Scott, Agent Manager with Girl Scouts Virginia Skyline, the one county I serve that's also in your coalition footprint in Knox County, just to get a little territory background.
Sorry, you cut out for just a moment there. You said Halifax County? We'll pop back to you. Okay. Allison, did you go?
Hey, I'm Allison Byrne. I am from the Richmond VA. I am the Community Engagement and Partnerships Coordinator there.
Thank you. And Shelley?
Hey everybody, I am Shelley from the Virginia Poison Center at VCU Health in Richmond.
Amanda.
Hi, I'm Amanda Hutchins. I'm the Southside Medical Reserve Coordinator.
More welcome.
Thank you.
And then I think Evelyn.
I'm Evelyn with Southside Behavioral Health and Day Support Services.
Good morning, Evelyn. Thank you for joining us. And then last but not least, our guest speaker for today, Dr. Jacqueline Barnette. Good morning.
Good morning. I'm Dr. Jacqueline Barnette, the owner of the Rising Development Center.
Glad you're here this morning.
Thank you.
So with that, I'll go ahead and pass it over to you if you're ready.
Okay.
Is there a presentation?
Yeah, she's gonna share a screen.
Okay, you're sharing.
We
Okay,
did
great.
earlier before the meeting started.
Okay, great. Oh, and Jamie just came in too, so we missed him.
Okay. Right there, she here.
Dr. Barnett, if you could click that link that says resume slideshow,
Okay.
little box, there you go, that should bring it up. Okay, and then. All right, and then click again.
Oh, she can also click this right here.
Okay, all right.
Oh, she can't see me.
No, she can't. Those
From the
slideshows-
beginning?
That from the beginning. There it goes.
There it goes.
Okay. Hello again, everyone. My name is Dr. Jacqueline Barnette. I'm the owner and operator of the Rising Development Center. And a little bit about me, I have a doctorate in psychology, and I'm also an LPC. I work in the mental health field in the Department of Corrections for about 17 years, and I have over 20 years of experience in groups and educational training. So some of my positions in the department were clinical social worker, counselor, psychologist, and psychology associate. I've also worked in the in the teaching field. I was a special education teacher with Bluestone High School and the with Mecklenburg County High Schools, now the new school, before I left in June of 2023. So you can see this is what this is our services that I provide for juveniles and for adults in the area. I do virtual and online services and face-to-face services. So you see there's a need for mental health professionals in the area. So over 37% of the US population live in areas that that it's a mental health shortage in. So there's a need for mental health services in rural areas. Can everybody see that, the screen, or is it?
Yes, we can see it.
Okay. So there you can see it's a need for mental health professionals in rural areas. So this slide is the problem. So you can see according to the Department of Juvenile Justice, over 98% of juvenile offenders have anger management needs. 9 out of 10 have substance abuse needs, and 6% have sex offender needs. You can see according to Department of Juvenile Justice, again, 1/3 of juveniles were convicted of felonies in the circuit court, and over 1/3 were committed to 1/3 of the convicted felonies were sent to the Department of Juvenile Justice. And that was like 27%. So I have the solution for I have a unique, authentic personality. I have over 17 years in mental health in the mental health field, over 20 years of group experience in educational and training. And I provide in this area and surrounding areas, I can go out of surrounding areas, individual therapy for juveniles, at-risk juveniles and adults. I provide group therapy, anger management, recidivism group, substance abuse group, and I also provide a soft skills training, which is outpatient coping skills. Does anyone have any questions before I move on, or if you want to ask your questions at the end?
Anyone in the room? No questions in the room, Dr. Barnett.
Okay. So, the Virginia VJCC Act placed over 7,000 juveniles in programs in 2018. In 2018, they placed over 11,000 juveniles into programs, the aggression management, anger, substance abuse, sex offender. So I'm in Mecklenburg County right now, but I want to expand to Halifax, Charlotte, Prince Edward, all the surrounding counties. And like I said, substance abuse, mental health issues, anger management, and soft skills training. This is the goal of my anger management program. And I'll show individual slides again, but the goal is to suppress the feelings of anger, but rather to promote anger in a healthier way. Promote it in a healthier way that, oops, I went too far. Promote anger in a healthier way that's able to express it without aggression. Why am I angry? The definition of anger. learn how to manage anger in healthy, constructive ways, identify the effects of anger to your body, and identify the triggers, and develop and strengthen skills for self-control and over thoughts and actions. So another program that I do is a substance abuse program. It's called Inner Reflections. To reduce the rate of incarceration by providing preventive measures and alternative to at-risk juveniles. Is goal-directed plan that can be used to gain and implement efficient and effective coping skills. It's an 8-week intensive program. I use evidence-based practices, cognitive behavioral approach. It identifies the triggers, the cravings, relapse prevention, and allows you to rethink how you perceive yourself and how you react to your triggers. Another program that I do is still evidence-based, cognitive behavioral therapy, is a recidivism program. It goes along with the substance abuse, reducing the rate of incarceration by providing measures of implementing efficient ways of reducing the rate of reentry back into the prison system. Learn how to recognize the negative thoughts, identify them when you have them negative thoughts, self-talk, meditation. Like I said, it's also evidence-based. Use the cognitive behavioral approach. And another group program that I do is provide at-risk juveniles soft skills, coping skills in communication, adaptability, teamwork. Those are all soft skills. Conflict resolution, all soft skills, and try to get them incorporated back into simulated back into the workforce. I devise a treatment plan to help maximize their potential into the workplace and gaining their independence. There's my contact information. I'm going to also show the pamphlets. I would give out pamphlets if I was there. But this is my contact information, 434-233-0177. That's my website there. And that's my email, risingdevelopmentcenter1@gmail.com. Does anyone have any questions before I show the pamphlets?
She mentioned the slides to post on that.
No questions in the room, Dr. Barnett.
Okay, let me stop sharing.
And if you send us those slides, we can post them.
Okay.
On the site. And then we can also distribute the brochure with, with the agenda and such.
Okay, I'm gonna share them now.
Okay.
All right. This is the soft skills development. Can everybody see it?
Can you zoom in just a little bit?
Oh. It's not working.
I think if you slide your cursor down there at the bottom, that bar, oh yeah, oh. Well, I don't know. There we go. That's a little bit better.
All right. Sorry about that. So the goal of the soft skills program is to provide skill development, teach at-risk youths and adults values of challenging work, provide success, independent living skills to home, provide interpersonal skills, provide independent living skills and taking care of paying bills and cooking, provide employment and financial literacy and money, provide academic skills for the ability to communicate through the literacy of writing and reading and math. And I have a curriculum that I go by, and it's skills to pay the bills to Department of Labor. Does anybody have any questions about this program?
If someone wants to get in touch with you, I see you shared your email and phone number. Is that then they set up an appointment? Is that appointment in person or online? Can you give me some details about that?
Oh, I can. They can call me. I would give out business cards right here. If I was in the room, I have business cards. Yes, they can call me. The intake is over the phone. And if we need to meet face to face, we can, but the intake is over the phone. I have a portal through Therapy Notes that's HIPAA, confidentiality, secure, that I use for all of my programs and individual therapy. So give me a call, 434-233-0177. I'll make an appointment and get you started with the intake process, and we can go from there.
Okay, great. Thank you.
All
Any other
right. Any other questions?
This is Dennis, just wondering a little bit on what agencies right now provide you some of those links or individuals that may be at risk? In other words, go ahead.
Sorry, go ahead.
In other words, do you have with the local EOs, with the high school, with, Mecklenburg County High School, what organizations are you working with then, or what organizations would you like us to help find those individuals that need your assistance?
Currently, I work with Piedmont Court Services in Boynton. I get referrals from them. Currently, I have I'm on the provider list for FAP in Boynton. And currently I'm on the vendor list for probation and parole with Miss Eileen Lewis in Boynton. And word of mouth is always, great. Previously I got a lot of referrals through word of mouth, but these are how I get referrals now. And any of you that would like to, just give me a call, I'll set them up appointment and we'll go from there.
Thank you.
You're welcome.
So I have a question, as far as insurance and billing. If we wanted to refer people, what insurances are you in network with?
In network with Medicaid, United Healthcare, Cigna, Aetna. That's all right now. I'm still credentialing Centera. At the fence on that too. I'm trying the process of Centera, but right now those are the ones that I'm credentialed in. And I do take self-pay out of pocket. I do take those as well.
Okay.
Thank you.
All right, any other questions for Dr. Barnett?
Let me go. I got a couple more. Do I have a little bit more time?
Oh, yeah, please.
Okay. Because I have another, let me share. share screen. All right, this one is a little bit better. This is a substance abuse program that is called Inner Reflections. This is 8 weeks. And the elements of this program is introduction to chemical dependency, the effects of drug abuse, stages of change, relapse prevention, emotions, continued relapse prevention, assertive training and conflict resolution, and continued assertive training and conflict resolution. And then at the closing, week 9, it's the graduation. All right, so I have a couple of more, 2 more that I would like to show you. The anger management and the recidivism. All right, so this is the anger management program here. So week 1, we'll do definitions and terms of anger, introduce ways to manage and recognize the early warning signs of anger, how anger affects your body, identify the triggers of anger, stress, frustration, and disappointment, understanding your thoughts when angry, negative, positive thoughts. Then week 6, stages of change. And then 7 is the graduation. All right, I have one more that I would like to show you. And this one may not show as well as others. Let me see if I can zoom in. It's not going to give me all of it, but the elements of the recidivism program, which all of the programs I do is evidence-based cognitive behavioral therapy. This is a recidivism program. The way you think is week 1, self-defeating thoughts, catch it, check it, and change it. Week 2 is soft skills and social functioning. Week 3, risk factors and barriers to change. Week 4, mental health issues, anger. Week 5 is mindfulness techniques. And week 6 is education, employment, and training. I just want to thank the coalition for giving me an opportunity to speak and provide services in the area. Does anyone have any questions?
Just one last question. Do you have any experience working with veterans or veterans' families?
I work with them in the Department of Corrections. That's about it. Yeah, in the Department of Corrections. Yeah.
Thank you.
Any other questions? All right, well, thank you, Dr. Barnett, so much for your time. Please make sure to email us, or maybe Keenan has them, but just in case, email us the slides and your brochures, and we'll be happy to distribute those out for you.
Okay, thank you. Thank you so much for allowing me to speak.
Yeah, thank you. All right, folks, the next item on our agenda let me see if I can share that to you so y'all can see.
There's all different types of files underneath that one link when you share.
Oh.
I think it's big. Tell me to press me. Yes, absolutely no clue how to do that.
Let me just go ahead.
I've learned a lot since 2020. Some things I just can't seem to remember how to do.
All right, there we go. Hopefully everybody can see that okay. So as far as the leadership team goes, my updates are we had our check-in last Thursday. We didn't have enough folks on the meeting to do a couple of the things we planned, like some of our bylaws reviews in our agreement, and so we've tabled that until the next meeting. But the things that we did discuss, we're just really aligning ourselves to be present for events this year. A couple of the events we're highlighting are, we're doing the event with Jamie and Christine and the Trauma and Resilience Program, the Lock and Talk, no.
Hidden in plain sight.
Hidden in plain sight, hidden in plain sight, hidden in plain sight. Sorry about that, Jamie. I bet, hidden in plain sight. That's coming up next month, and then we're doing, we have our other event with the YMCA. Have we planned that yet, Keenan?
No.
No, okay, so we have a pending event with the YMCA. We're also planning a drug take back day, which will be coming in October. We are moving forward with the We Stand Together Summit for LGBTQIA folks, which is also looking like it's gonna be in October. And then Christine and I are talking about some exciting partnerships and trying to build our youth side of the coalition. And so would you like to share more about that? I don't want to do, I can, but I don't, okay. So ultimately, you know, it's been a goal of the coalition for some time to grow our youth engagement and just have a youth coalition. The ultimate goal would be to have a youth coalition. Some of the ways that we've thought to do this are doing a joint coalition for the Wellness Coalition and our Trauma and Resiliency Program. And so we would have youth leads who were responsible for reporting to each entity, but would work collectively together to further our collective mission and sponsor any youth-led events. So that's in the works. We're still talking about, we're still working on it, very early in the process, but making sure that we are aligned and ready to move forward and working with partners to make that happen. So I think right now we'll pass it over to Jamie. I think I saw you on there. If you'll just give us a little bit more information about your Hidden in Plain Sight event coming up. You might have, oh,
There he is.
there you are. I can't hear you. I can see you, but I can't hear you. We're right here. It's Sarah.
Oh, was she locked up?
No, they just, I heard him say they're here for the meeting.
Oh,
So I
okay.
told them here.
Okay, yeah.
Sarah Con. No, Weissman.
Oh, she's out here. We bring her in?
No, she's.
Okay.
Okay.
Is he speaking?
Yeah, it looks like he's not muted.
I see him. Let me text him. Hello. Hey.
Yeah, it won't even let me unmute him.
Oh, really?
That's strange, yeah.
Oh, click the, no, he's unmuted right now.
Yeah, I know,
He's
yeah.
unmuted right now. Let's turn his volume. Yeah.
A few technical difficulties, folks. Sorry about that. So while we're figuring that out, I'll pass it over to any other leadership team folks. Laura, let's see, I didn't see Will on the call, but Elena, if y'all have any updates you'd like to share.
As far as the COC goes, we're still accumulating the data that we gathered in the point in time count. So I don't have any updates on that, but should have at the next meeting.
Okay, thank you. All right, well, Jamie, just pop back on if you can. We'll. And then my other update for you all is, as most of you know, we did our veterans needs assessment last month. It went very, very well. We partnered with the VA and the Clarksville VFW. It was a wonderful event. So our April meeting will be dedicated to reporting out the information that we gathered during that needs assessment. And so just want to highlight that for folks who are particularly interested or work with veterans and want to know more about what they said they needed in our community. So please join, tell your colleagues to join, because I think it's going to be very useful information for a lot of folks.
And Allison, want to follow up with anything about that?
Allison, did you have any follow-up or anything else I should mention about that? Yeah.
No, not really. Just wanted to thank everybody again for all of your efforts and putting this together. And, I think it went really well. We got a lot of good feedback. I don't want to spoil anything for next month, but definitely excited to report out to y'all next month on it.
Awesome, thank you.
All right, can I jump in? Jamie's not able to get his microphone connected.
Yeah.
All right, so I gave everybody in the room, and then it's also under the share file, the hidden in plain sight next month. We've got the strategic partnerships that we talked about at our retreat, right? Yay. We've got the Poison Control Center, so Shelley Clary's on here with us today, along with Mecklenburg County Sheriff's Office, as well as the Trauma Informed Care Network and the Coalition and Southside Behavioral Health. There's going to be a hidden in plain sight event, April 21st, it's a Sunday afternoon at Bethany Baptist Church, which is in Baskerville. If you're familiar with the area, that's the town between, I think, Boynton and South Hill. It's right after Mecklenburg High School. On the right is Baskerville Road. It's right off of 58. It's going to be a presentation in conjunction with the Sheriff's Department, looking at what every parent, coach, teacher needs to know about the risky behaviors that young folks participate in. In the presentation, Jamie's going to talk about local drug trends, common items found in teens' rooms. I'm going to have a presentation with our locking medication boxes. Shelley's going to talk about the Virginia Poison Control Center. Christine's going to be there talking about resilient pathways, and many other folks. In fact, folks are reaching out on a daily basis saying, can I come? Can we share about our services? Like the Department of Health. And so it's created quite a buzz online and on social media. We're advertising it in newspaper. We certainly hope, I know Jamie hopes, we all hope that this will continue to be a regular event in our community. We've reached out to Halifax's local officers there to see if they'd like to come and see what we're doing in Mecklenburg County. We've also reached out to the Brunswick County officers and reached out to them, let them know to come and again, see the presentation. Right now, we're forecasting 50 to 100 people to attend this event from 3 to 5. And again, as I said, we're hoping that this becomes a regular event that we host in the community. It is an initiative that goes on across the state. For you, those of you that are old school like me, back in 2018, we did invite the Culpeper Police Department here, and they did do a presentation at South Hill Elementary and at Halifax High School. And so we, of course, move forward as a coalition and working with Jamie to develop that program in our area. So we're super excited. We hope everyone comes out for that.
Thank you, Keenan.
No worries. And I need you to talk about that too. Don't forget.
I have one of those flyers.
Oh, yeah, I'm sorry.
Okay. Because now we're moving into Mecklenburg and Brunswick, that sounds like a good thing to be at.
I have some of the ties into that when we get to code.
Pardon me?
I have some of the ties into that. Code of March.
Oh, yeah, last weekend on 16, I know. I did too, and I couldn't. I know, I did too.
All right, folks, the last thing I have for you in terms of a leadership update is we are partnering with Brenna Link and VDH to celebrate the Youth Tobacco Prevention Innovations Project. This is going to be Mecklenburg High School. It's going to be held April 25th from 10 a.m. to 12 p.m. Registration is required, so we do ask that you email Keenan if you have any questions. I can share that. I promise I'll get this sharing and chatting at the same time thing down, y'all.
Yeah, so that's not an open community event. That is specific for coalition members. That's specific for the teachers and the students that worked on that fantastic project. You know, the grant started during COVID. We were not able to, you know, host anybody in person, bring the young people together. And so Brenna is our keynote speaker to these young folks and their teachers about the importance of what they've done, how they've created social media graphics around nicotine prevention, vaping prevention, all the great stuff you guys have probably seen on our social media. One reason for the event is to celebrate with them and have lunch, and also for Sarah to show them the great work that they did, because we imagine that even though they've been working on the project, they may or may not be following our social media. And so therefore they might have actually seen, other than through their teachers, their graphics online, real time, of this is a real powerful campaign. So we're putting together a presentation for them to see their analytics, how these graphics have been organically shared. Monica said, oh, she's not here. So we're super excited for that. But it's not necessarily open to the community. We're going to be in the multi-purpose room. We're hoping for a good turnout from all 4 of the schools we participated with. So it was Mecklenburg High School, Brunswick County High School, Halifax High School, and then also the young folks that are in the programs at the Southern Virginia Higher Education Center in South Boston. So 50-some students who've probably never met, have been working on this social media project, are going to come together, have lunch, and talk about successes and challenges. And Brenna, I know she's on there, if she wanted to add a few things about what she plans to talk about.
I have nothing to add to what I'm talking about because I'm still figuring it out, but I am very excited and I'm honored that you thought I was the person for the job. So thank you, Keenan.
No problem. We're gonna be fabulous.
So we also talked about being able to use the opportunity to really talk to them about public health as a career field too. I know it's something myself and some of our staff are really passionate about, because even admittedly, I have a master's in public health and I didn't realize that was actually a career field until like my senior year of undergrad. So really just, and the programs expanded a lot across the last few years. So we're really excited about also using it as the opportunity to just kind of be like, if you enjoyed working on this project, if you enjoy learning more about how to help the community and do the outreach and how to educate people on healthy choices, that this might be a career field that you can explore.
Awesome. And I'll add on, so we are looking for coalition members to come celebrate with us. Obviously, as a side note, we encourage their membership into the coalition, talk about some of the opportunities that are available to them with working at the coalition, that even though this grant ends in June of this year, that their good work and their passion for helping their other peers out and knowing about what, you know, vaping and nicotine can do to our bodies, that they might decide to become part of our effort.
It's the goal. We hope, we hope. Well, all right, thank you so much, Keenan and Brenna, for pulling that together. Excited for more on that, and then I'm sure we'll hear updates after. Elena, I'm gonna pass it over to you real quick. I know you shared that y'all don't have anything except for the pit data, or any updates on the pit count data. Any other COC updates that you think the Wellness Coalition should be aware of?
Nothing that comes to mind. We do have our next meeting scheduled for April the 12th. So at our next meeting, I should have a little more information for you.
Okay, awesome. Thank you. All right. Well, now I'm going to turn it over to Sarah and Amanda with Engaging Halifax and the SEED initiative. So if y'all want to come on up, the owl, y'all can do it from there, but the owl will follow you.
Yeah, you want to stop share so camera will capture them.
Oh,
Looks like you put on the spot.
Just
Get
got
the
thrown under the
seagulls,
bus.
man.
Well, I'm trying to, because Amanda's taking my position in 2 weeks, let her, you know, handle it.
And I've got some hard,
experience.
the hard copies for y'all, and then it's
Okay.
also under the share file too,
Okay, awesome.
under the
go ahead
meeting
and pull that
files.
up.
It's under the meeting files. That one, yeah. It's called Engaging Health, that is. How do you do that so seamlessly?
I grew up with this. I was the media generation.
Okay, where am I looking?
This owl thing.
Okay.
Yeah, it can see you, it can see you.
All right.
It can see you.
So right now, what we really need help with is we are trying to conduct a focus group on Tuesday evening of next week. And so we have already assembled this one topic group, and the topic group is people in recovery, people in active addiction, and then their family members. And they worked with us to decide who they wanted to hear from and then construct questions that they wanted asked from these people. So Keenan and Liam had suggested that a lot of the people that are part of this coalition would kind of check those boxes of people that we need. So let me, I guess, first tell y'all who we need from like what kind of area that they identified they wanted these questions answered from. And then if you are interested in helping us, just, I guess if you're online, maybe can they send it in the chat and we'll be able to see?
Absolutely.
Yeah, if you just comment in the chat that it works for you and that you'd be willing to help us, we'd really appreciate it. We're gonna do it over Zoom. It'll be in the evening. We'll make sure it kind of works for everyone, and it shouldn't take very long. It's a page list of questions that we have, 1 page. And we just kind of need to ask these so we can take it back to our focus group, and then they can work from there from the answers they got. So who we need are employers. So specifically employers in the community that employ people that have had addiction or arrest or things like that. I know we were told Hitachi does some employment with people that have records, but we've been unable to identify any other employers in the community. So even if you know of employers that we can contact, that would be a huge help for us. Our next one are any doctors. So any doctors in the area that would be willing to answer some of these questions, that would be great. Educators, so anyone that works in the education field, social services, and it doesn't have to actually be like the state social services. It can be anyone that works kind of in social services in terms of like a nonprofit that might provide the same type of thing, anything like that. Anyone that's from the Board of Supervisors, and then anyone that is part of the faith community. Not so much just attending, but someone that like leads a church or leads like groups or things like that at their church. So those are really what we need right now. And so if anyone fits that bill, we would really appreciate you reaching out. Okay, I was like, I can't understand what they're saying. And then,
You're talking about just Halifax County, right?
yes, this is just in Halifax right now. And you don't have to live in Halifax or anything. If you just work in Halifax, that can be fine. Or if you work somewhere else, but you live in Halifax, you just have to have some connection to Halifax one way or the other. And then we are also starting this in Mecklenburg and Brunswick. So we've recruited, Jamie, I believe, he's one of the, I can't remember his last name, but he's a peer support peer. And then someone else.
James.
James.
Oh, James in
Yes.
Brunswick County.
Yes.
Yes.
And then.
James Barnette.
Yes.
Yeah.
Okay, I got you.
And then there's a woman, but I can't remember her name, and she does, I guess Mecklenburg. But I can't remember.
Lottie,
Maybe.
Yvonne.
Are they both Yvonne? That's it.
They're peer support specialists.
Yeah, so we've recruited them to kind of help, so we're gonna start
Awesome.
branching into recruitment for that group soon too. So if you work in one of those 2 places and you're interested in helping join, we need 24 people from each one, so 24 from Brunswick, 24 from Mecklenburg, to help us get this off the ground there. And here we are still trying to recruit 8 more providers to join the team and a few more EMT, police officers, judges, lawyers, people from the jails. We've gotten okay response from there. I think that's all firefighters too. So if you know anyone in any of those groups and you want to pass their information, that would be great as well. But primarily with y'all, what we needed were people to fill this focus group that can answer some of these questions for us that are from those different sections and can help us to take it back to our topic group.
And as you said, this is next Thursday night?
Next Tuesday.
Next Tuesday.
Yeah, I got mighty close. I was like, awesome.
I think
It's a great down on there.
I think too, like we'll pay you if you join us.
Says over there. All right.
This is for like the whole. Okay.
Oh, Brenna, my bad, Brenna.
Okay.
Yeah, Amanda, that would be perfect. It's okay if you're no longer an educator, you have plenty of experience and you just left, so.
Oh, and Grace's got something in there too. An employer. She's got an employer in there. Yeah, she's got Total Image Solutions, South Hill.
Okay. Awesome.
But they also may cover out in that too.
I'm gonna just.
Oh, you're taking a picture of it? So you're doing Amanda Hutchins. I can get you her email and her.
That works, Sherry, that would be great. We've opened up to anyone that's retired, like, has moved. We had someone that was on the drug task force here in Halifax, but he's now in Richmond. He's joined.
Okay, and then Grace gave you something in the chat too.
Yeah.
Okay, I can get that.
And
Total
I can,
Solutions. Total Solutions.
I can have someone share my contact information in the chat as well.
You can chat it right in there if you want.
Okay.
Just go up to the chat. Yeah, the Zoom is live. Go ahead and hit the chat. And you can type your contact information right in there. Leah made it really large, which amazes me. Yeah.
Former EMT, yeah, that'll help. I don't think we have any
Did everybody
EMT.
see that large chat? That is the coolest thing ever. Can they see it?
So that's my cell phone and my email. You can call me, text me, email me, whatever. I'm very responsive, so.
EMT in Halifax. I don't think we have any EMT, so that would help out a whole lot.
Yeah.
Elena might have connections to other EMTs.
Okay.
Yeah, I mean, I can post it on my Facebook if nothing else.
Love that.
Absolutely.
That would be great. And if y'all want to send me a message too, or shoot me a text, and I can, if I didn't cover anything or you have any questions of who to look for, feel free, and I will do my best to explain anything that I might have missed. So this is for like the topic groups.
Yeah.
All right, that's all I have.
And then Brenna said he wants the flyer. I can give you her email.
Okay, awesome.
Thank you all. All right.
Yeah. I just want to speak that. So I know we.
Y'all have any other questions or things for Sarah or Amanda? Feel free to keep putting them in the chat. We'll monitor them and relay them back to them.
Now. In the logo.
Yep. And then we'll do an overview, final overview of the events and share everything that's on the table.
Sure, that'd be
Okay,
great, that'd be
cool.
great.
All right, next on our agenda, we have, oh, I didn't pull our agenda back up. I'm sorry, y'all. Thank you for being patient with me. Next on the agenda, we have an update from Sakova. Stephen, do you have any updates?
Yeah, thanks. We met on March 4th via Zoom, and our speaker was a fellow named Tim McKay from Media Partners, and I'm sure some of you are familiar with him. He helps out with campaigns at CSB's media campaigns. And he was talking about a podcast he's got coming out. It started March 14th. It's every other Thursday, and every episode will be a little bit something on a different topic related to what we do, be it alcohol, marijuana, vaping, suicide prevention, problem gambling. And he said he can set up a booth at the next big conference if anybody needs it, but I've got his email address if anybody wants that. This podcast will be hosted on all the large platforms, Apple, Amazon, Spotify, I think iHeart is where it's hosted. He did come up with one thing that I was not aware of. Just a statistic, I guess, gambling accounts for, or problem gambling accounts for more suicide deaths than any other addiction.
Oh, wow.
And we've been looking into, working a little bit with the gambling side of things recently, you know, so that might be something to keep in mind, as we pursue our focus. New education coordinator, Frances Gardner, but she didn't really have anything to say right at that point. As far as bill tracking, only two right now that really impacted us. The bills for legalizing the markets for marijuana have passed both sides, and that'll go to the governor. I think maybe we'll see whether they decide to give him a stadium so he'll sign it. That seems to be the hold up there. I don't know. If they block the stadium, he may block the bills, which may help us out, you know. July 1st, skill games will be back in the convenience stores and everywhere else. I think everybody's seen that. The next Sakova Summit will be October 20th through 22. It's not gonna be a one-day affair this time. Go down the night, still go down the night before and all that, but you'll actually spend the next week. They're looking to create work groups soon. They have signed the contracts, and they'll have emails going out soon. They need sponsors and a theme. We'll need to consider whether we think a booth is appropriate for us. I don't know if we're too far away, but possibility. They're trying to keep the price down. They were wondering if 250 to 300 is too much for groups. You know, there are a lot of groups out there that are a lot smaller than ours, you know, so that price point becomes an issue. But one thing King was talking about hidden in plain sight earlier, Martinsville or Henry County just did a house party with this stuff. And what they did was they went out to the local community college and set it up in the gym, and they set up rooms, each room being a room in a house. So if you went to the bedroom, that was maybe hidden in plain sight. When you walked into the bathroom, it was medication and lock boxes. And each room had a theme, and I just thought that was the coolest thing ever. It's March 16th, and I was trying to go and could not. I desperately wanted to see that because our original hidden, I can't believe it was 6 years ago, but when we did Hidden in Plain Sight, then it was just the coolest thing. One of the coolest things I'd ever seen us do. It was so interactive, and it caught people's attention, I believe. May 8th, Danville, Pathways to Resilience, not Resistance. And the 2024 Pathways to Resilience in Roanoke will be June 18th and 19th. And I've got some other stuff that I sort of printed out. If anybody has any questions, if I can get it for you, I'll know who to call there. So thanks, that's all I got.
All right, thank you.
Can I add on, did you all talk at the leadership team meeting about folks attending some of these conferences?
A little bit, yeah. We
Okay.
can, yeah, let's connect on that.
Okay, I'll follow up with you.
All right, folks, any questions for Stephen about Sakova, or we'll talk a little bit about the Pathways to Resilience conferences or summits in just a bit too. I'm not seeing any chats or anything, so I'm gonna keep it moving. The next item on our agenda is Sarah has been kind enough and patient enough to work with us for the last several months to redesign our logo. Oh, that's the wrong one. My bad, y'all.
And it is in the share, it's in the media files.
Okay.
And it's called logo update.
Okay. So I'm gonna put those on the screen. At our last leadership meeting, we narrowed it down to two with some suggestions. Sarah was kind enough to go back and revise those again for us. And so my ask of you all today as our general members, is to pick between the two. So the first one you see here, the three people representing the three counties, the Southside Wellness Coalition at the top, and then the counties we serve at the bottom. And then similarly with the second logo, again, the three people representing the three counties, with just a little bit different formatting. But similar styles with the coalition at the top and the counties at the bottom. And so we have a Survey Monkey link for you all.
It's not live yet.
It's not live yet.
No.
We will have a Survey Monkey link. But just so you
I
can,
didn't realize it's not live.
that's okay.
I'm right there.
This is life, you know, and so just so you all can have some context, here's what it looks like in white and black, so the grayscale for each. And you know, our goal is really to make something that is super recognizable, but also looks good on printed materials, is easily translatable to any sort of website or emailing format we may need. So, and when the Survey Monkey link is distributed to you all, my ask is that you hop on and just pick the one you like so that we can start rolling with our new logo. If you have any questions, feel free to email me or Keenan. We can point you in the right direction and we will get you, we'll send out copies of these logos with the survey link so
Yeah.
that you all can
Is
see
it
it.
okay if we launch it near the end of the month and then run it to the next meeting? And then also have it available during the next meeting, so we can hopefully get close to 50 of our members to vote like we did with the election.
Yeah, so you wanna open it, we'll open the link April 1st and it'll be available until the end of April.
Right, that sounds
Okay,
great.
cool.
Okay, I'm ready.
All right, so just in case y'all didn't hear that, we're gonna open the link April 1st to vote. We'll keep it open until the end of April, so that we can really make sure all members have a chance to review and give any input they have.
Okay, and I'll ask them to do a special blast through the newsletter link. So if everyone's getting the newsletter, they'll get the link to vote.
Perfect.
If you click the link, it's not gonna say April Fools, just kidding.
Oh, that's true. Maybe we should do April 2nd. Yeah, the idea that we're changing our logo, right? Yeah, that's good.
Okay, that's a good thought.
Okay.
Maybe April 2nd on that link, guys, so
Yeah,
so
okay.
folks don't think we're
Good
pranking
idea.
them on April Fool's Day. All right, so now I want to open up the floor for any member news, any you all online or folks in the room. If you all have things you'd like to share, I know Christine has some things, so I'm gonna pass it over to you to start, if you don't mind. And then we'll move to online folks.
Ready to go there.
You can, yeah, if you want to.
I'm gonna be quick. I'm gonna be quick.
No, please. Okay.
Hello, hello. I'm Christine Pennington. I am the chair for our local Trauma Informed Care Network, which is Trauma Awareness and Resilience Partners. And we are trying to build our membership. So if you have an interest, we partner with Southside Wellness Coalition. We do a lot of similar projects together. And we would love to build the TARP membership. So on the landing page for Trauma Awareness, Resilience and Resilience Partners, that landing page is on Southside Wellness Coalition's website. And there's a link on that to sign up for alerts or interest to be a member. So just encouraging everyone, if this is in your wheelhouse of interest or the field of work that you do, please join our membership. We do have our starting monthly meetings. Right now, we've got leadership. If you're interested in leadership, please make a note of that as well. Thanks.
Thank you. All right, anyone online have any member updates or things they'd like to share out to the group?
Yeah, since you were mentioning April 1st, I had to continue on that wavelength because starting April 1st, actually across the country, girls can, they're in pre-K, rising kindergartners, will be able to start joining Girl Scouts. It's kind of a newer thing in recent years, so I'm always telling anyone and everyone I talk to about that specifically. but specific to Girl Scouts Virginia Skyline, we've been offering free membership to girls, and we've extended that offer through July 31st. And it's a very exciting thing sometimes, but sometimes people also think that there's some hidden agenda. Oh, it can't really be free. I'm like, no, we have very generous donors out there. I don't know. They don't tell me. I just am the recipient of able to tell people in the community. So I'll put some information in the chat.
Any other members have updates they'd like to share?
Well, I'd like to introduce myself.
Yes, please. Hi, welcome.
Hey, I'm Amanda. A lot of people know me as Mandy. I'm the medical reserve port coordinator for Southside. It hasn't really been utilized a lot in this area. Our main objective is, of course, during emergency, helping to be response for the local emergency team and helping them out. But during non-emergency, we still want to help our community by providing in health aspects. I have volunteers that do want to participate and help in any events that you guys have going on. We're more than welcome to help with that. Right now, I'm trying to get trained and being able to offer Revive as well as you guys do. I'm also a Revive trainer now. I'm trying to get my volunteers to also become Revive trainers and be able to help offer that. I'm trying to become a Stop the Bleed trainer as well and be able to offer that to our community to help build up our resilience in emergency situations. I'm becoming certified in CPR as well. I'm trying to be able to offer all of this stuff to our community at no cost. So I was just trying to explain what I'm here and what we can do.
Amazing.
Where's she located?
Where are you located, Amanda?
Actually, they hid me in the WIC office in Boynton.
Okay.
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 Awesome. She said that she's gonna be teaching, offering CPR at no cost.
I'm going to try to. That's what the ultimate goal is.
All right, awesome, awesome. Yeah, I'll
But
follow you because I can't find anybody that's not charging.
I know that's why that's part of what we're here for. I'm supposed to use all these trainings with my volunteers to make sure they have all of that under their belt for when we are deployed in emergencies. But we also need to make our community self-sufficient. So we're trying to offer all those out. Right now, I can do Revive and Stop the Bleed for free because I'm ready for those, but the other ones I have not started yet.
Amanda, what certifying body will you be doing CPR training through? To be certified?
American Heart Association is where
Okay.
I've started.
Okay, thank you.
That'd be awesome. Yeah, Amanda, we'll definitely be in touch. And by we, I mean Keenan.
Yeah,
The
definitely.
collective.
Yeah, we've already got a meeting for tomorrow.
Oh, okay, cool. Oh, great. Great, I love that.
You got somebody in the waiting room.
I got somebody in the waiting room. Oh, it's Sarah. All right, any other, thank you, Amanda, appreciate you. Any other updates or things folks want to share out?
Once you got it intended plans.
Okay, so the next things on my list, sorry, y'all, I know, we're a little over 11, so we want to roll it on
You got
here.
somebody in the room that wants to do a member update?
Oh, we got another, oh, I'm sorry, go ahead, Dennis, go for it.
Yeah, I'm Dennis Amians. I'm with the American Legion here in Clarksville. But in Vets on a Roll, we take vets out on the lake. We started back up again. We will be going April, June, and September. For this April, for those that are with the VA Medical Center, I will be sending you my information. My point of contact there is Sean Simmons, but I will be coordinating with the Virginia VA, Durham VA, Danville VA and Clinic. We also now have added the Butner Virginia Support Center, which is going to be sending us a number of outpatients from there also. And I have coordinated with Keenan. So once I finish with them, if it's all right with them, we will be adding the suicide prevention as a part of the activities in April. The meeting, we will be taking them out April 17th, which is a Wednesday. The VA centers bring buses. Butner will probably be a bus. In Danville, we coordinate with the local VFWs and American Legions for them to help bring patients from the Danville clinic here also. So we will be adding y'all. I need part of the coalition. If there are things you need from veterans or would like to discuss with veterans, bring particularly the VAs, your Richmond reps, please bring those up because we get a nice cross section and we normally have somewhere around 50 veterans from the various VA different resources. Again, I'll be coordinating with y'all and anything else or other coalition members that believe that they can add to our veterans outreach. Thank you.
Right, awesome. And you said that was April 17th?
April 17th.
April 17th, all right.
And Keenan will have all of our times. And we also would like those that want to work with families with special needs. We will be taking those families out on the lake for a day on the lake in, let's see, let me check the calendar. May 19th, which is a Sunday, and we'll also be doing it on a Sunday in October because it's related to families, particularly caregivers of those families that have special needs. So again, for those organizations that wish to provide pamphlets or things to assist, particularly those caregivers, contact Keenan, who will pass it on to us because we're looking for those individuals. We have also now expanded our outreach to Granville County, North Carolina, for them to bring a number of their families also.
Awesome. Thank you.
Thank you.
All right. Any questions, folks, for Dennis?
Hey Dennis, this is Allison from the Richmond VA. I'm the Community Engagement and Partnerships Coordinator. I just wanted to get your information. I would love to, be involved and support any way we can from Richmond.
Yes, ma'am. I've got your name already.
Okay.
So I will get your information from Keenan, and then all of the information I will forward you about what we do and how we do it. So that way you will be on our email list.
Awesome. Thank you so much.
And will you be coordinating with Angela Jameson, or do I need to reach out to her separately?
So Angela's actually, she was kind of covering this area while we were filling the role. So I'm going to be continuing with the coalition. So you can just reach out to me. Angela covers more of like Northern Central Virginia, Fredericksburg, and out to Charlottesville.
Cool. All right, Allison, you are now the Stuckey.
Thank you.
All right. Pause for questions, concerns, comments. Not hearing anything, gonna keep it moving. Thank you all for staying with us a little bit longer today. Gonna pull up a couple of our events coming up, just so y'all know. Our next virtual revive training, that already passed, is gonna be April 8th. And then, let me see, pulled it up.
And I've got flyers in the room.
So these are the 2024 through June training dates so far. Again, the next one for Revive is gonna be Monday, April 8th. It is gonna be a virtual training. Contact Keenan to
Now,
register.
these
for
obviously, that because they're virtual, the links don't click for those of you in the room, obviously, it's stating obvious. It's just an advertisement, but when it gets emailed out and newsletter, it does click to go to that Zoom link so you can register. Because people get aggravated with me about that, I'm like, I can't control that, it's a virtual class.
Okay, our next virtual class is our virtual assist.
Oh, wait a second, we got two Revives in person coming up.
I'm sorry, y'all.
April 6th, we're having one in South Boston at the Mount Pleasant Church.
We also have an in-person.
Might be a place you guys get captured, a few people. Just saying. We're having that in church in South Boston, actually not, sorry. I say South Boston loosely, it's in Halifax on Mountain Road. And then you all know that Christine is having one at Resilient Pathways on May 22nd. And of course, we were just talking that we might link up with Amanda If she could do CPR with the Revive that day on May 22nd, I think we have enough time to plan that out. That's there too. And then we do have an assist next week here in this building. There are 2 open seats available if you know of anybody who's interested.
Oh, I'm working on it.
The assist next week.
I gotta keep up with Keenan.
Oh, no, sorry.
You're okay.
They're all in there. They're all in there.
You are well
They're all in
organized.
there. Oh, not that one. It's March. Sorry,
Okay.
it's March.
Sorry, y'all.
Keenan, you
Sorry.
move as fast as I talk.
So we've got lots of good stuff. Isn't it awesome? We have so much wonderful stuff happening. We're gonna add more. Yeah, that one. It's next week. We still have 2 available spots. That's in person here. Got 2 trainers coming in that are clinical, having a little bit of breakfast. Probably not my cake though, just want to say. And then, lunch. I couldn't make so many cakes.
Okay.
And, then also, what you guys probably saw, we blasted on social media, was,
What are we doing now?
the press release about the harm reduction kit. That's okay. And this would be something too, to share with EMS. We launched, harm reduction kits. The press release went out. The papers put it in their paper. I was so excited. What it is that we are looking for partnerships in the community, local emergency service partnerships to distribute harm reduction kits in the community. We know that we are still losing people to overdoses every day. We know part of that issue is that folks are turning away services for whatever reason. From, I think my Narcan, I don't quite understand, because maybe I don't have an Revive training. I understand that Narcan wears off and I can go back into an overdose, so I send emergency services away. Or I overdose and then decide I don't want to go into treatment right now today. These harm reduction kits, which I'm gonna grab one real fast. Hang on a second. Can I grab one real fast? Hang on.
All right, while Keenan's grabbing that harm reduction kit, I'll just go ahead and share the rest of the events we have coming up real quick. So just want to make everyone aware of the Pathways to Resilience coming up on May 8th. That's going to be at the Institute for Advanced Learning in Danville. The Wellness Coalition and our Trauma Awareness and Resilience partners is sponsoring this event. We're gonna have some great speakers. So make sure you register for that. That's also on our social media and coming out.
Harm reduction kits,
And
you see on the press release, are made for folks who, again, have not yet decided to seek help. And so we're asking local emergency service responders. By the way, Brunswick County Sheriff's Office has already come and picked up numerous bags. So they have already, as of last Thursday, CIT, we are distributing these to folks that need in their community. So they know, right? They know the homes they repeatedly visit. They know if they get called to an overdose, they're gonna distribute these. So these are not just distributed at our tabling events. These are targeted towards those folks who again may be in need of harm reduction until they decide to seek services. So inside the bag, you can see on your list, I just want to show you, first aid kit, syringes, alcohol swabs, sterilized water, fentanyl testing strips, and then, of course, we know, really good information, right? How to use the testing strips, what are some safer use items, they're all English and Spanish, and then also the names of information about local treatment facilities, right? So if they, of course, we know stigma around this chronic health condition. People don't want to go back to the hospital. They don't want to seek services. So we're giving them the information they can have in their homes, right? So it's fantastic. We would love to expand beyond Brunswick County Sheriff's officers to other local emergency services. So if you have any connections, we're looking for those relationships. And I'm sure you're probably wondering, what do they have to do in exchange for this? All they have to do is report back to me when they're running low on their bags, how many more additional ones they want. And then during the month, what day they gave out the bag and in what town. So Brunswick County took 30 bags. They're recording what day they're dropping them off and what town. Obviously, as imagined, they already have to keep running records anyway, where they go and what they do. So it's just gonna be easy duplication of what they're already doing. So a great opportunity. So if you have any connections to emergency services or you're a member of emergency services, please talk to me. We are making hundreds of these bags as they get requested.
Cool. I went over that one while you were out of the room.
I got that one.
Yeah.
Okay.
And then we got two more for you folks.
The youth survey.
Is that this one?
Yes. And you guys have probably seen on our social media many times, but the deadline is going down. If you know any young person that lives in Virginia, lives in any county in Virginia, that is between the ages of 18 and 25, the state of Virginia, is developing their young adult survey. It's a 30-question multiple choice survey asking you questions about, your substance use, your attitudes and beliefs around mental health, wellness, lifestyle choices. And when they get to the end of the survey, they have the option to accept an incentive. And in our area, it's a $25 digital Amazon gift card. What Sarah and I have been doing, we've been camping out at various locations because what happened a few years ago, we did this before, young people, and I'm guilty of that, their attention spans are really, short. And we had just a little over 100 responses for our area, but we had more than half of that were incomplete, meaning that the young person started taking the survey, they got distracted, didn't finish it, the survey times out, we don't get the data, and they don't get the gift card. So what we've been doing over the last month, and we'll do until April 16th of the college campuses, is we're setting up in the lobby, we're asking them to come over, we're asking them to complete the survey right in front of us, like at a table from a distance, so that they stay in arm's reach. And when they get to the end where it says incentive and they click they want it, then from their email, they have to give their email, obviously, so they have to identify themselves, not in the survey, but it goes to My Survey Monkey. It's all quite fancy. It goes to My Survey Monkey, it pops on My Survey Monkey. I show Sarah the email. She goes into an online gift card app and sends them $25 right there to their phone before they leave. We have gotten over 109 responses so far in the last month and a half.
Nice.
So it's been really successful, but we still would like to exceed our 110 from last year. We're hoping to get 250 young people by April 16th. So if you know anyone or need some extra copies, all they do is text the word Virginia to that phone number. It comes up and asks them, are you asking to take a survey on young adults? You say yes. It takes them through 30-question multiple choice, and at the end, they have the option to receive an incentive. Now, if your young person is not in Halifax, Mecklenburg, or Brunswick, they'll still get an incentive. We just can't access it. They might get Target, some CSBs are giving Chick-fil-A, some CSBs are giving Starbucks. We just thought with our little area, $25 Amazon gift card would be great.
Are you okay if that's announced, like if you posted something on social media or?
We're not allowed to post anything about the $25 Amazon gift card because we're afraid we'll get scammed. Bots will pick that up. But the flyer, this is the flyer we're permitted to share that has our logo on it. I'm just letting you all know that's what the young folks in our area are receiving. And it's been going very, very well. Our tracking tracks when they received it, when they opened it, when they redeemed it. Not that they bought, but they opened it and redeemed it. So we're able to track that using our grant funds. The state approved that. And we've got quite a few young folks who initially were like, survey. I said, well, if you finish it, you get a $25 Amazon card. We did a bunch of students at SPHC just 2 days ago. All right, that's it.
All right. And then the last thing is the Race App Summer Conference. coming up, I mean, we are ways out, but just want to put it on your radar, August 28th. It's again going to be at the Institute for Advanced Learning and Research in Danville. Some more great speakers coming for you, but just want to put that on your calendars and your radar so you all can be prepared. But I think that's all we have for you today, unless anyone has any information they'd like to share or questions. I think we can go ahead and end the meeting.
Just don't, just stop the recording.
Yep.